listen to your lungs in the front. Take a deep breath with your mouth open. In and out. Good. Again, in and out. And lift your right breast. Deep breath in and out. And lift your left breast. Deep breath in and out. Okay. We'll listen to your heart now. Breathe normally. Can you lift your left breast? And hold it up for a little longer. Okay, I'm going to listen to your lungs in the back. Take a deep breath in through your mouth. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Two more. Deep breath. And last one. Deep breath.
I'm going to listen to your lungs. What I'm going to have you do is just take a nice deep breath for me. Perfect. Again. Perfect. Just take a nice deep breath. Perfect. So now I'm just going to listen to your heart sounds, but first I'm going to listen to your carotid. So can I have you tilt your head back and take a nice deep breath and then hold it for me? Okay, now you can release. Now for the other side. Perfect. So now I'm just going to listen to your heart just in a few areas, and I'm going to name them while I listen to them. This is your aortic, your pulmonic, your Erb's point, your tricuspid. I'm just going to come right up under here and listen to your mitral. Okay, perfect. So now I'm going to lay you down, and I'm just going to do the same thing. Let's listen to the DVD. Okay, that sounds good. So I'm just going to listen to the same areas.
So big deep breaths. Go ahead and lift your left arm up for me. Deep breath in. All right, go ahead, and then this arm as well. Very good.
Now I'm going to listen to your lungs, so take a big breath in and out through your mouth. Deep breath. Again. 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 And again. And take a big breath in and out through your mouth. Blow as hard as you can. Okay, now just breathe normally. I'm going to listen to your heart now. So now I'm going to listen to your neck. Can you turn your head to the left and hold your breath? Take a breath, turn your head to the right and hold your breath. And you can breathe normally. Now I'm going to listen to your lungs in the back, so take a deep breath in and out through your mouth. Okay, deep breath. And out. Again. And out. Again. And out. Again. Out. Again. Out. Again. And out. Again. Out. Again. 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 In. And out. In. And out. And in. And out. And in. And out. Good. So I'm going to put the stethoscope on a couple places along your chest and back. As I do that, I'd like you to whisper 1, 2, 3. Okay? 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Now let's do that along the back. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Now I'm going to go to all the same places, and I'll like you to say E-E. 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 Do that along the back. E-E. 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 Okay. I'm going to go to those same places, and I'd like you to say 99.
99, 99, 99, 99, 99, 99, 99, 99.
I'm going to do that along the back.
99, 99, 99, 99, 99, 99, 99, 99.
Take a deep breath for me. Again. Alright, I'm just gonna basically do the same thing. Okay, so deep breath. Alright, just coming under the breast a little bit. Alright, so now I'm going to check your carotid artery. So if you would take a deep breath and hold it. Alright, release. And then do it again, please. Okay. And so now I'm going to check your heart. I'll start with aortic, pulmonic, Erb's point, tricuspid, and then under here, your mitral valve. Alright, so if you would lay down for me, please. Okay, just going to check your heart again. So aortic, pulmonic, Erb's point, tricuspid valve, and your mitral valve.
Just gonna listen right here. And on the other side as well. I'm gonna put the stethoscope right here. On this side. Great. Deep breath. Good. While we're here, I'm going to have you say 99.
99. 99.
Perfect, you can relax. And say E for me.
E.
Say 99.
99.
Say E.
E.
Great. Just listen to the side. Deep breath in and out. Say 99.
99.
Say E.
E.
This side. Deep breath in and out. Say 99.
99.
Say E.
E.
Perfect. So I'm just going to listen. Deep breath. Deep breath. Deep breath. Say 99
99.
and say E.
E.
Deep breath. Say 99
99.
and say E.
E.
Thank you. I want you to repeat back 1, 2, 3, but nice and soft, okay? Say it.
1, 2, 3.
And again.
1, 2, 3.
And again.
1, 2, 3.
And again.
1, 2, 3.
And if you can turn around one more time. And again.
1, 2, 3.
And one more time.
1, 2, 3.
Great.
I'm gonna listen now with the bell end. And there's no bruise noted. Okay. Listen to that. Okay, and then the last one is over here.
good for 1 minute. Okay, sounds of the lungs. There's no discrepancy. No rhythms. Sounds
Okay,
clear.
so your apical heart rate is 84 beats per minute, and no murmurs noted in any of the other heart spots. Now I'm gonna listen to your lungs. So we're just gonna have you take some deep breaths as I listen.
Just gonna listen to your
Okay.
abdomen for vowel sounds right here. Right lower quadrant. Sounds loaded. Right upper quadrant.
Okay. And the back.
Upper. Okay, sounds present in all of the areas, and in the meantime while I'm here listening, I'm gonna listen for your aortic sounds, abdominal aortic sounds. There's no voice sound.
Okay, so the lungs are clear bilaterally as well as anterior and posteriorly, and there are no adventitious sounds, no accessory muscle use as well. I'm going to listen
Okay, I'm gonna
in all 4 quadrants.
do the motion of your shoulders very quickly. I'm just gonna spread your arms for me. And muscle strength looks perfectly fine. 0 to 5, 0 to 5. She can hold it under gravity. And just gonna ask for the forward movement.
Okay, so there are active bowel sounds in all 4 quadrants.
Auscultate for breath sounds. If you can come back again. I'll have you take deep breaths, okay?
Okay.
Take a deep breath. Okay, I'm gonna auscultate your breath sounds here. Deep breath. Bilateral breath sounds are good and equal. No wheezing, rhonchi, or crackles. No. So aortic. Can you take a deep breath and hold? Okay. Pulmonic. Breathe. Second pulmonic or Erb's point. Tricuspid. And mitral. So S1 and S2 heard loud in all regions, and there are no abnormal murmurs or gallops heard. I'm going to check your heart again as you're lying down. Up. You want to speak up a little? So aortic again. We'll do it with the bell. Pulmonic. Tricuspid. And mitral. Okay. And as I'm checking the PMI, I'm also going to As I'm auscultating, I'm going to also check for the carotid pulse. And they're both synchronous. Okay, so that is good. Next, I'm going to check your abdomen. Okay, so we'll put this up a little. On inspection, the abdomen looks symmetrical. I don't see any bulging, no nodules, no bluish discoloration, nor the rash or redness over the abdomen. Can you lift your head a little? And I don't see any herniation with increased pressure on the abdomen. Next, I'm going to auscultate. So we're gonna first auscultate the bowel sounds. And that's in all 4 quadrants. I can hear bowel sounds in all 4 quadrants. I'm gonna auscultate the epigastric region for a venous hum. And then the umbilicus. No venous hum noted. Next, I'm going to auscultate the aorta. No bruit present. The renal arteries. No bruit. Iliac artery. And the femoral artery. There's no bruit present in either of those.
And let me know if at any point you become uncomfortable or you need to take a break. Just let me know, okay? Alright. No discomfort with any of that? And do you have problems with your breathing?
Nope.
Nope. Now I'm gonna have a listen again. And like I said before, if you need to take a break, just please let me know, okay? And I'm gonna start up at your throat to see if I can hear any bruits. Alrighty, everything sounds good, so I'm gonna move down to your lungs. I'm going to listen down below. And on the other side. Good. No pain with that? now I'm gonna do your apical pulse and I'm gonna stay here for a full minute, okay?
Okay.
All right, and your heart rate was 71 beats per minute, which is very good. All right, I'm gonna move down to your stomach, okay? Do you have any stomach problems, pain, uncomfortableness, regular bowel movements? All right. I'm gonna start by listening, okay? I'm gonna pull your shorts down just a little bit. All right. Everything sounds good. Lots of bell sounds.
You're gonna take a listen to your heart. Okay, you can breathe normally. Okay, now I'm gonna let's go listen to this. Okay. Just gonna take a listen to your respirations. First, can you just take a deep breath for me? Okay. Now I'm gonna listen. Deep breath. One more. Again. Let's take a walk around. Tom, can you take a deep breath? Great. Okay, now I'm gonna listen to the back of your chest. And I just still need you to take a few more deep breaths.
Okay.
Okay, one now. Again. Again. Time. And one more time. Okay. Okay.
Take a deep breath and out. Great. And out. Good. Another one. and out. Another one. Good. One more. Out. More. And out. And out. And good. Alrighty. So let me listen to your lung sounds from the front, okay? Put this down a little bit. Okay, take a deep breath. And out. Good. In. And out. And out. Good. You're okay. And out. Good. And then now I'm going to have you raise your hands above your head. And I will listen here. Take a deep breath. And out. And then this side. In. And out. Good. So your lung sounds sound good. You can rest your arms. And I was looking at the distance from the front and the back. It's called the anteroposterior diameter, and it looks good. Okay? So everything sounds good and looks good in your lungs. Next, I'm gonna drape you so that we can do your heart. Okay? Okay, then I'm gonna raise your gown.
Okay. Do you want to put you on the counter?
Here. I'm gonna have you lean forward a little bit. Okay. Okay, all right. I'm gonna listen, and I will start with the top right sternal border, listening for any bruise, and then the left, and then I will listen here. That's your Erb's point. Good. And then I will repeat the same with the bell. Good. I do not hear any bruise or any thrills. I do not hear any murmurs either.
Oh, good.
Next, Miss Denise, we're going to look at your belly, okay? You will notice a slight change in the order that I'm going to do it. I will first look or inspect, and then I will auscultate. I will listen. Usually that is the last part to do, but in the abdomen, we don't want to start touching and percussing, and then we'll activate your bowels, okay? Alrighty. So I do not see any lesions, any change of color, no sweaty, clammy skin, okay? Now let's listen. And I'm going to listen with the diaphragm. Start with the right lower quadrant.
Okay.
Good. And then the right upper. Good. Left upper. And then your left lower. Good. And your bowels are moving just fine. And check your renal. Good. Now check your iliacs. Good. Okay. Good. So take a deep breath and hold. Good. And then take a deep breath and out. Good. Now take a deep breath and hold. Great.
Perfect. Good deal. Deep breath in. Good. One more time. Perfect. All right, everything sounds good. Deep breath in. Do the sounds right here. One more. Good. Now I'm going to listen to your heart, the precordium. I'm going to do the aortic, the pulmonic, second pulmonic, tricuspid, and mitral. Perfect. Now I'm going to listen with my bell. I'm going to do that one more time. We've got aortic, pulmonic, second pulmonic, tricuspid, and mitral. Perfect. I'm going to get you to lay down. I'm going to listen one more time. So let me move this out of your way. I'm going to listen while you're lying down. Perfect. So let's take another listen. I'm going to first listen with my diaphragm. Aortic. Pulmonic. Second pulmonic. Perfect. So we're going to listen to the bell one more time. Good deal. Everything sounds good. So I'm just going to listen to for vowel sounds in all four quadrants. Perfect. Then I'm going to listen for any bruits in your renal arteries. Good. Iliac. No bruits. Good. And femoral. Perfect.
Now I'm going to auscultate them, listening for any bruits or abnormal sounds to your carotid. Okay. No bruits noted to the left. No bruits noted to the right. Alright. Deep breath. Breath. Alright. Just take a breath. Take a breath. Okay. Lung sounds are clear and equal bilaterally. I'm going to listen to your heart valves right quick using my diaphragm. This is the aortic, pulmonic, tricuspid, alright, that was tricuspid. Now I'm going to listen with the bell of my stethoscope. Okay. No abnormal sounds noted. Alrighty. Now I'm going to look for PMI. No heaves noted. No abnormalities noted there. I'm going to listen to your breath sounds right quick, okay? Just breathe normally. Okay. Lungs are clear and equal bilaterally. Okay. Alright. Normal active bowel sounds noted in all 4 quadrants. No bruits or abnormalities noted.
Go right into your shirt here. And yeah, feel your radial pulse at the same time. around to the front. Deep breath in. Great, I didn't hear any adventitious sounds, no wheezing, no crackles, no striders, sounded very nice.
Okay.
Now I'm going to do your cardiac.
Okay.
We'll just start right here. At aortic. Pulmonic. Greater S2 is louder here. Herb's point. S1 and S2 are equal. Tricuspid. I'm just going to go right under your brow here for mitral. Good, your S1 is louder there. Nice heart sounds. I didn't hear any murmurs, no extra S3 or S4 sounds. Listen to the 4 quadrants of your abdomen.
Okay.
I'm going to stay here for a minute as well. Six there. Four there. Four there. Five there. I'm just going to take a listen with the bell for any bruise. So when I put my stethoscope on you, just hold your breath, okay? Good. Go ahead and breathe. And hold your breath one more time. Good. So there's no sound of whooshing, which means there's no bruise present. So I'm going to start up at the aortic heart, which is in the second intercostal space on the right. I hear S2 sounds loudest here. Then moving over to the pulmonic, which is in the second intercostal space on the left, where S2 sounds are heard loudest. The herbs, which is in the which is in the third intercostal space, where S2 sounds are heard loudest. Good. Moving down to the tricuspid valve, which is in the fourth intercostal space. S1 sounds are heard loudest. And over to the mitral valve, where S1 sounds are heard loudest. And I would listen here for a full 60 seconds for the apical heart rate. So I'm just going to switch to the bell and listen for any abnormalities. Mitral. Good. Tricuspid. Herbs. Pulmonic. And aortic. Good. So I don't hear any abnormal S3 or 4 sounds. I don't hear any murmurs, so the heart sounds are strong and even. Just going to take a listen to your lungs now. Whenever you feel my stethoscope, if you could take a deep breath for me, okay? Let me know if you get dizzy at all. Go ahead and breathe. Good. And again. And again. Go ahead and breathe normal for me. So the lung sounds are equal bilaterally. I don't hear any adventitious crackles or wheezes. And let me check her lateral sides. Good. So no adventitious noises there. Let's check your back. Can you take a deep breath for me? Good. And again? Okay, go ahead and breathe normal. So I don't hear any adventitious sounds on the back either. No cracking or wheezing. Good. And lung sounds are equal bilaterally on the back as well. Good. So bowel sounds are present. I hear high-pitched gurgling. If I didn't hear it, I would wait for 5 minutes in each quadrant. I'm going to listen to your lungs. So I'm going to have you take deeper breaths than normal. If you get dizzy, just let me know. Okay? Deep breath. Good. Bring it up. Deep breath. Good. Deep breath. Deep breath. Good. Deep breath. Good. Deep breath. Deep breath. Deep breath. Deep breath. Perfect. Good. Lung sounds are clear, all 4 lobes. Let me just listen now. You can breathe just normal. Perfect. Respirations are regular and even, and the rate is 16. Okay, perfect. Lungs sound good. Now I'm going to listen to your chest. So I'm going to have you go ahead and lay down for this part. I'm going to check your heart. So I'm going to be listening in different spots on your chest.
Okay.
So just breathe normally, okay? I'm listening to the 5th intercostal space on the left sternal margin. Good. The rate is 80. Heart rate is regular and even. Now I'm just going to listen to your valves. First valve I'm going to listen to is the aortic valve. It's on the 2nd intercostal space on the right sternum border. Next is the pulmonic valve, 2nd intercostal space, left sternum border. Herb's point, 3rd intercostal space, left sternal border. Tricuspid valve, 4th intercostal intercostal space on the left sternal border. And mitral valve, fifth intercostal space, left sternal border. No murmurs are noted. Now I'm going to listen for your carotid arteries in your neck. I'm going to have you take a deep breath in and then hold it. Good. Take a breath. I'm going to listen to the other side. Go ahead and take a deep breath in and hold it. Perfect. No bruits are noted. Perfect. Valve sounds are normal in all four quadrants.
Okay, so no bruits were heard. That's like a swishing sound. Okay. Okay. Next is the pulmonic, which is the second intercostal space, left sternal border. Okay. Next is Erb's point, which is the third intercostal space, left sternal border. Next is the tricuspid, which is the fourth intercostal space, left sternal border. Okay. Next, I'm going to auscultate the aorta with the bell of the stethoscope and listen for any bruits. No bruits noted.
I'm going to listen with the diameter of my stethoscope. So I'm going to listen to the aortic valve, which is on the right sternal border, second intercostal space. The pulmonic valve, which is at the left sternal border, second intercostal space. The Erb's point, which is on the left sternal border, third intercostal space. And this is where you can hear S2 the loudest. I'm going to listen at the tricuspid valve, which is at the left sternal border, fourth intercostal space. And the mitral valve, which is at the fifth intercostal space, mid-clavicular line. And then I'm going to listen to your apical pulse for a full minute. All right, by my clock in my exam room, it's been a full minute. Angela's apical pulse was 68 beats a minute. So right now I'm going to go ahead and listen to your carotids, and then I'm going to listen to your lung sounds, okay? So I'm going to listen to the carotids with the bell of my stethoscope. So I'm going to lean it back a little bit. First thing I'm going to do is going to palpate the carotids. She has 2+. She has 2+ carotid on the right side. I'm just going to go ahead and listen for any bruits. Can you hold your breath for me? And relax. And hold your breath for me. And relax. There you go. So now I'm going to listen to your lung sounds in 8 different areas on the anterior chest. I want you to take some deep breaths in through your mouth while I'm doing this, okay?
Okay.
All right. Deep breath in. Very nice. So Angela has clear lung sounds. So again, I want you to take deep breaths in through your mouth. And I'm going to listen in 10 spots down here, okay? With the diameter. All right, she had clear lung sounds, no advantageous sounds. I'm going to listen with the diameter of my stethoscope. Starting at the right lower quadrant. And I hear a positive vowel sound. If I didn't hear something, I would listen for 2 to 5 minutes before saying that it's hypoactive or not there. Moving to the right upper quadrant, I hear a positive vowel sound. Left upper quadrant, positive vowel sounds. Left lower quadrant, positive vowel sounds. So I'm going to flip my stethoscope to the bell. I'm going to listen for aortic bruit. I can hear your pulse, but I don't hear a bruit. We'll listen over the renal arteries. I also feel your pulse down here, or hear your pulse, excuse me. I don't hear a venous hum, but that would not be a abnormal finding if I did. I don't hear any bruits. I'm going to listen down here at the femoral arteries. I don't hear any bruits down here.
All right. I'm going to have you take deep breaths, and I'm going to listen to your lung sounds. And then your lateral lung sounds. All right. You can take deep breaths. Let me know if you feel dizzy. All right, next, I'm going to listen to your heart sounds, okay? I'm going to start in the center intercostal space, listening to your aortic region. Pulmonic. Tricuspid. And apical. All All right, since I don't have a bell, just the diaphragm, I'm going to just do it one more time. But if I did have a bell, I would go back to those regions and listen again. Aortic, pulmonic, tricuspid, and mitral. And then I am going to listen to her bowel sounds. I'm going to start in the lower right region. And they're active.
Now I'm going to auscultate her posterior chest. Breathe in for me. Let me know if you get dizzy. And her lateral breath sounds. Okay, now I'm going to take a listen. Again, starting above the clavicles. Go ahead and breathe for me. Very good. And now, before I move on, I'd like to go back briefly and do a sharp and dull sensory test. I'm going to do this. I'm going to show you what soft and dull feels like. This is dull, and this is sharp. And I want you to let me know when you feel that. I'm going to do it on your face. Okay? You close your eyes for me.
Dull, sharp, dull, sharp, dull, sharp.
Very good. Okay. Next, I'm going to have you lie down. And, excuse me, before you lie down, I apologize. I'm going to go ahead and take a look at your heart.
Okay.
I'm going to inspect your chest, noting for any rise, any thrills, or heave. None is noted. Now I'm going to take a listen to the areas of her heart, starting with the aortic. Aortic. Pulmonic. Tricuspid. And apical. If I had a stethoscope with a bell, I would be listening in those areas, but since I do not, I'll be taking the diaphragm and listening to those areas of the heart again. Starting with the aortic, pulmonic, tricuspid, and the mitral. Okay. Now I'm going to take a look at your peripheral vascular system. I'll be palpating all of her pulses bilaterally except for her carotids, which I will begin with and palpate separately. Okay. And now her brachial, her radial, her femoral, her dorsopedialis and her posterior tibial. Okay, while I'm down here, I'm going to be noting for any edema, any dependent swelling. There is none. It's warm, and a capillary refill is good, less than 3 seconds. Very good. Okay, now I'm going to have you lie down, if you will, and I'm going to inspect your abdomen. Just going to lift your, yep, very good. Okay, first thing I'm doing is assessing, just inspecting rather. I'm looking at the general contour of her abdomen. Everything is symmetrical. Her umbilicus is midline. As she's breathing, it's rising evenly. So next I'm going to take a listen. I'm going to auscultate the quadrants of her bells, starting in the right upper quadrant. Right lower. Left upper. And left lower. I am hearing active bowel sounds. Go ahead and take deep breaths for me. Let me know if you get dizzy. Okay. Take some breaths for me. Okay. Now I'm going to inspect your abdomen. So I'm going to have you lie down. I'm going to lift your shirt here just to expose your abdomen. I'm looking at the general contour of her abdomen, the alignment of her umbilicus. It is midline. I'm going to go ahead and take a listen. Starting in the upper right quadrant. And I'm listening for bowel sounds, and they are active. I'm going to start with your aortic, your pulmonic, tricuspid, and your mitral. If I had a stethoscope with a bell, I would do that, but I do not. So I'm going to take a listen to all of the heart sounds again with my stethoscope. Starting with aortic, pulmonic, tricuspid, and mitral.
Placing the stethoscope on the patient. And determining the patient's blood pressure. Patient's blood pressure was about 110/80. I'm now going to auscultate. So every time I move my stethoscope, I want you to take a deep breath in, okay? auscultate for the different areas. So I'm going to do the right second intercostal space for right aortic with the diaphragm and the bell. And then again for pulmonic, the diaphragm and the bell. For tricuspid, diaphragm and bell. And for neutral, diaphragm and bell. I'm going to do the precordial, diaphragm and bell. Alright, I'm going to compare the apical and the peripheral pulses. Okay, and if you can roll over all the way on your side for me, as I check for the apical impulse. Okay, good. And I'm going to have you sit up for me right here. Lean forward, take a big deep breath in and hold it. And I'm auscultating over the fourth, the fifth intercostal space at the left sternal border. Okay, good. I'm going to start with the right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant, and the abdominal aorta. Now the renal arteries and the iliac arteries. Okay.
Alright, I'm just going to do some of your typical vitals real quick on you, if you don't mind. So I'm just going to take your blood pressure. You can just relax your arm. Relax. Well, 10/70. That's very good. Very good. Alright, now I'm just going to listen to your heart. Do you mind if I just close the heart a little bit? Thank you. Touch. Alright, you're at about 78 for your heart rate. Okay, now I'm going to listen to your lung sounds, okay? Every time I move my stethoscope, I just want you to take a deep breath, okay? Very good. Now I'm going to do the same thing on your back, okay? Sure. Okay, very good. No crackling, no wheezing, which is very good.
We would make sure our stethoscope is in a bell position, which we are. Hold your breath for me. Okay, there are no bruits noted. We would also listen to different areas of the carotid, listening for any abnormalities. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay. I would also listen to the front. Deep breath. Deep breath. There are no wheezes, no crackles, no rhonchi noted. All lobes are clear throughout. We would start by listening to the aortic, pulmonic, second pulmonic, tricuspid, and mitral. The mitral would be auscultated at the 5th intercostal midclavicular. Everything was noted, S1 and S2, regular rate and rhythm noted. I'm going to lift up your shirt a little bit.
Okay.
Okay, there are no bruits noted. And we're going to be listening to all 4 quadrants. Vowel tones are noted in all 4 quadrants. There's no abnormality in tones, no hyperactive vowel tones, no hypoactive, and no absence of vowel tones. We're normal reactive in all 4 quadrants.
Her blood pressure was 110/72, which is regular. Will you take a deep breath through your mouth each time I touch you with my stethoscope? Okay, and auscultate. Can you do the same thing as last time? Deep breaths each time. Okay, and auscultate, so deep breaths every time, just like before. And I'm going to auscultate all 4 cardiac points, first using the diaphragm. So the first one is the second right intercostal space, second left intercostal space, Can you please displace your breast for me? Fourth left intercostal space at the left sternal border. Fifth left intercostal space at the midclavicular line. Then I'm going to do the same thing with the bell. So this is aortic, pulmonic, tricuspid, and mitral. Now I'm going to auscultate the carotids. Can you hold your breath for me? And that's using the bell. I'm going to auscultate the apical impulse using the bell. Can you roll over on your left side for me? Okay, that's checking for mitral stenosis. Now I'm going to correlate the apical and peripheral pulses. They seem to be about the same. Can you sit up for me? Using the diaphragm between the fourth and fifth intercostal space at the left sternal border, I'm going to be checking for mitral regurgitation. Can you lean forward for me, exhale, and hold your breath? Great. This is the right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant, the epigastrium, abdominal aorta, the renal arteries, and iliac. Okay.
So now I'm going to take a listen. And if I could just have you every single time you feel my stethoscope, take a big deep breath in with your mouth. And let me know if you feel dizzy or lightheaded.
Okay.
Once more down here. Good. Good. All right, I'm going to listen. You would just take a big deep breath out your mouth when you feel my stethoscope on your back, and let me know if you feel lightheaded or dizzy.
Okay.
You okay?
Yep.
Okay. All right, perfect. I'm just going to listen to your heart sounds. Starting up here in your right aortic area. over here to the pulmonic area. Right here to Herb's Point. Right, and over here to your tricuspid area. And over to your mitral area, which I'm going to leave at for 60 seconds so I can count your pulse. All right. Got 73 beats per minute, which is normal. All right. Good. I hear a lot of normal vowel sounds. So I'm going to have you hold your breath in. Nope, and I don't hear anything there. Okay, whenever you're ready. Okay, I'm just going to move to your back side here. Alright, some deep breaths in and out. Good. Listen to the bell. Okay, so aortic. Pulmonic. tricuspid, mitral. All right, and I can hear S1, S2, and I don't hear any clicks or murmurs. So I'm just going to do that a couple different positions. So I'm going to have you lie your head down.
Okay.
Put it here. So I'm also inspecting for jugular venous distension, which I don't see. And I'm just going to take another listen. So I'll kick video. Yep. Okay, aortic. Pulmonic. Second pulmonic. Tricuspid. Mitral. Okay, and if I could have you lie on your left side, that will be the last spot that I listen to everything. Aortic. Pulmonic. Second pulmonic. Tricuspid. And mitral. And that all sounds just fine. I hear S1, S2. I don't hear any clicks or murmurs at all.
And they're active. Your valve sounds are active there. And they're active. And you have active valve sounds sometimes all four quadrants. You know, if I was auscultating and I started to hesitate and think that maybe I was not hearing any valve sounds, I would have to auscultate for a full 5 minutes by the watch to make sure before I could accurately say that there was some absent valve sounds. Okay. Now I'm going to auscultate for any bruit of the vasculature of your abdomen over your aorta here. There is no bruit noted. This is your renals. I'm hearing nothing at all. Your iliacs. And I'm going to go a little bit lower around your femorals. Okay, good. I'm going to start at the anterior portion and beginning on your neck. And this is your bronchial respirations. Take a deep breath in and out. Good. And on bronchial respirations, the pitch is higher and the amplitude is a little bit louder, and the expiration is usually louder than the inspiration on your bronchial respirations. Take a deep breath in. Okay, good. You have vesicular breath sounds over the main portions of where your lungs lie, and you have a bronchovesicular over just to the lateral sides of the sternal border. Here it's more moderate in pitch and amplitude, and the inspiration and expiration should pretty much match as compared to the vesicular breath sounds, where it is softer and lower in amplitude and pitch, and also the inspiration over the vesicular breath sounds are going to be louder than the expiration. I'm going to listen to the posterior portion of your thorax. Deep breath for me, Lindsay. You always want to follow the same pattern when assessing your breath sounds. And again, with the vesicular over the lung fields and the bronchovesicular along the spine. I'm going to start at about the mid-clavicular line and assess for your point of maximum intensity first, with a kind of a little bit of a deep palpation here. And I can feel it about right here. And we're at the mid-clavicular line, about the 5th intercostal space. And it's about 2 centimeters in width and a quick pulsation feeling which is normal. I'm going to take a listen. You had a normal S1, S2, with S1 being louder than S2 at the apex of your heart. It's nice and even and regular. It's about 64 beats a minute, which is a nice healthy heart rate. I'm going to take a listen to your, continue to listen here. S1, S2 is noted. I'm going to listen to the base of your heart. S1, S2. And at the base of your heart, it's a normal finding for the S2 to be louder than the S1. I'm going to move on down and listen to your heart valves. You're going to start at the second intercostal space to the right of the sternal border here. This is your aortic valve. Okay. Second intercostal space left of the sternal border is your pulmonic valve. Third intercostal space left sternal border is your Erb's point. Fourth intercostal space left sternal border is your tricuspid valve. And your fifth intercostal space, midclavicular line, is your mitral valve. Okay, I'm just going to do a quick assessment here. The same valves again with the bell of my stethoscope. You should get in the habit of going in the same order. Erb's points. Okay. Excellent. All your cardiac assessment is appears to be normal. I'm going to listen for any bruise in your carotids here. There's no bruise there. I'm going to take an auscultation at the apex of your heart and check the pulsation in your carotids. They should be accurately together, which they are.
Now I'm going to take a listen to you. First, I'm going to listen to lung sounds. So each time I press or touch your skin with my stethoscope, just take a deep breath in and out. No adventitious breath sounds. Now I'm going to take a listen to heart sounds. She came in with complaints of chest pain. So I'm going to go ahead and take a listen to her aortic sound, which is going to be the second intercostal space on the right side. Pulmonic, second intercostal space on the left side. Tricuspid, which is going to be the fourth intercostal space. I'm sorry, the third intercostal space on the left side. And the mitral, which is going to be the fifth intercostal space, midclavicular, on the left side, which is usually just below the breast. Okay, I'm going to go ahead and take a listen to her abdomen. All four quadrants. When was your last bowel movement?
About 6 hours ago.
Okay. Bowel sounds are active, which is a normal finding. Okay.